The Pathophysiology of Type 1 versus Type 2 Diabetes Mellitus by Kimberly Jared. Here's a little picture of some words that you might see associated with diabetes, if you want to take a look at that. Okay, what is Type 1 Diabetes Mellitus? The pancreas does not produce insulin, which is necessary to allow glucose into the cells. There is an absolute insulin deficiency, so you might hear insulin-dependent diabetes when referring to type 1 diabetes. It typically appears in children or adolescents. However, it can develop at any age. Only 10% of diabetics have type 1 diabetes, and the plasma glucagon is elevated, and these patients are prone to ketosis. Here's a little picture that I really liked, and it just basically shows the stomach changes food into glucose. The glucose enters the bloodstream, and then the pancreas makes little or no insulin, and little or no insulin enters the bloodstream, causing glucose buildup in the bloodstream. What are the symptoms of type 1 diabetes? Patients typically present with polyuria, polydipsia, polyphagia, and unexplained weight loss. How is type 1 diabetes diagnosed? The patient must meet one of the following criteria: symptoms of diabetes plus a random plasma glucose over 200, a fasting plasma glucose over 126, or a 2-hour plasma glucose over 200 during OGTT, which is oral glucose tolerance test. What is the treatment of type 1 diabetes? Insulin. These patients, like I said before, are insulin dependent. There are many types of insulin: short, regular, intermediate, and long-lasting insulin. Insulin is absolutely necessary for the patient to live. Some patients may need glucagon if they are hypoglycemic and their lives are in danger. These patients need to have a healthy diet, exercise, and patient education is crucial. They need to be educated on glucose monitoring, carbohydrate counting, and understanding how much insulin they need depending on the carb intake and exercise level. Also, the healthy diet and exercise can delay cardiovascular complications and can improve the patient's cardiovascular function. What are complications of type 1 diabetes? Hypoglycemia. This is very dangerous and can be life-threatening if not corrected. Diabetic ketoacidosis. The symptoms can include deep, rapid breathing, dry skin and mouth, flushed face, fruity breath, nausea, vomiting, stomach pain, fatigue, muscle stiffness or aches, frequent urination or thirst that lasts for days. There is no insulin to break down the glucose in DKA, so the body breaks down fat for energy instead. The ketones start to build up in the patient's blood and urine, and it is very poisonous. Patients can experience the dawn phenomenon, which is early morning rise in blood glucose with no hypoglycemia during the night, or the Somogy effect, which is hypoglycemia at night followed by rebound hyperglycemia in the morning. Now moving on to type 2 diabetes. What is type 2 diabetes mellitus? It is the most common diabetes. About 90% is type 2, and most of these patients, it is completely preventable with their lifestyle. Patients present with chronic hyperglycemia, and this diabetes may range from an inability of the pancreas to secrete insulin or an inability of the tissues to respond to insulin. You can take a look at this picture here, and it just shows that the pancreas doesn't have enough, or there is a sufficient amount of insulin secreted into the bloodstream, and there is an increased glucose in the bloodstream, but the muscles are unable to use the glucose due to insulin resistance and the insulin receptors. Obesity, inheritance, and other factors lead to insulin resistance. I really liked this picture as well. Basically shows there's too much food with too much animal fat can cause it, not enough exercise. One set of genes inherited from parents make you hungry, overweight. Fatty deposits in the pancreas cause even more damage, and the result is the body needs more insulin, but it just cannot produce it, so it will cause type 2 diabetes. More causes of type 2 diabetes: genetic susceptibility, obesity, poor diet, lack of exercise, smoking, high fat and cholesterol levels, and high blood pressure. What are the symptoms of type 2 diabetes? Again, this patient will have polyuria, polydipsia, polyphagia, and fatigue. How is it diagnosed? You need to check their blood glucose. You need to check for microalbuminuria. And for diagnosis, one of the following three criteria must be met: symptoms of diabetes plus a random plasma glucose over 200, fasting plasma glucose over 126, and a 2-hour plasma glucose over 200 during OGTT again. What is the treatment of type 2 diabetes? Diet, they need to control their blood sugar. Exercise, that is very, very important. They need to change their lifestyle first before you start them on medications. Metformin is a common medication used to help treat diabetes. If there's no change in the A1C after 3 months, then you can add a variety of different medications to the metformin. The worst case scenario for type 2 diabetes from prolonged and uncontrolled diabetes is they may have to use insulin. Patient education is key with these patients because, like I said before, it is completely preventable. People can change their lifestyles and they can get rid of this disease as well. What are some complications of type 2 diabetes? Increased risk of cardiovascular disease, recurrent infections, visual changes, neuropathy, microvascular disease, retinopathy, which is the leading cause of blindness, nephropathy, which is the #1 cause of kidney failure, and macrovascular disease, which consists of coronary artery disease, stroke, and peripheral artery disease. This concludes my presentation. Here are some resources where I got some of my information and my pictures. And I'm going to end on this quote that I really like, and it is: "The food you eat can be either the safest and most powerful form of medicine or the slowest form of poison." Thank you.